All right, welcome back to the show, Thyroid Thrivers. If you've ever looked at your labs and felt more confused than clear or wondered why you're still struggling despite normal results, today's episode is for you. My special guest, Inna Topiler, a board-certified clinical nutritionist and thyroid expert, is here to shed some light for us on a powerful but often overlooked concept, the 5 different thyroid types. We're going to talk about what they mean, how they affect your symptoms and labs, and how understanding your thyroid type can help you fine tune your nutrition and your healing strategy. Hello, Thyroid Thrivers, and welcome back to another episode of the Thyroid-Healthy Bites podcast, with bi-weekly episodes dedicated to helping you eat well, live well, and feel well. I'm Ginny Mahar, a functional medicine health coach, cordon bleu chef, and your thyroid health and cooking coach. So if you're ready to get inspired, informed, and empowered with thyroid-friendly food and lifestyle topics, expert interviews, and tales from the healing journey, you're in the right place, friend. Let's dig in. So welcome to the show, Inna. I'm so excited to have you here. It's so fun to connect.
Thank you so much. I'm so excited to connect with you. I know this has been a long while in the making, so happy to be here.
Awesome. Well, before we dive in, I'd love to tell the listeners a little bit more about you. Inna Topiler is a functional nutritionist, clinical educator, and the founder of Complete Nutrition and Wellness. She specializes in helping women with Hashimoto's and hypothyroidism uncover the root causes of their symptoms and create personalized healing strategies through nutrition, lifestyle, and functional testing. As the host of the Thyroid Mystery Solved podcast and creator of the Thyroid Types Framework, Inna is passionate about making complex thyroid science practical and actionable. Through her work, Inna helps thyroid patients understand their bodies more deeply and take practical whole person steps toward thriving with thyroid disease. So we're two birds of a feather here today. And if you want to learn more about Inna, you can check her out at innatopiler.com. That's INNATOPILER. And also check out her Instagram at Inna Topiler. That's how I connected with you, Inna, and you've got such awesome content on there. Everything from, supplements to thyroid specific nutrition to low tox hair color and fun little personal glimpses into your life and experience as a Hashimoto's patient. So just lots of fun, relatable content there. And I just know our conversation today is going to be so valuable for the listeners because so many of us don't really understand, I think, what our thyroid numbers mean for us. And even if we do, kind of have a sense of, normal numbers are not optimal and all of that, there's patterns that we might miss there and that doctors often overlook too. So this can just really make the difference for us between thriving with hypothyroidism and just struggling along, barely able to get through the day. So I'm really excited to dig into this conversation.
Me too.
One of the things that I really admire about your work is how it's very rooted in your own journey, and you've been really open about that. Some of the challenges you faced: brain fog, fatigue, migraines, acne, IBS, and coming out the other side of that with everything that you've learned. Could you maybe start by sharing a little bit with us about your thyroid journey and how it led you to the work you're doing today?
Of course. And thank you, by the way, for this beautiful introduction and all of your kind words. I appreciate that so much. And yeah, so my journey, I think as a lot of providers get into this work because we first needed it for ourselves and we struggled. And really, the hope is that once we figure it out, that other people don't struggle the way we did, right? And so for me, I was always kind of a sickly child, but nothing was really kind of wrong. But I got colds a lot and I had tons of, I remember like gas and digestive issues. And I actually grew up in Lithuania and my grandmother was a doctor there, which is not very common for, females to be doctors, in Western Europe. And um, because she had all these associations with other doctors and hospitals, anytime anything was wrong, I would get antibiotics. And they didn't even really do oral antibiotics. They would do antibiotic shots, like in your bottom, which was super fun. I still remember my mom literally chasing me with shots of penicillin around our house. But as we know now, antibiotic use, even not necessarily even prolonged, but just even a little bit of antibiotics can really wreak havoc on so much, right? Our gut, our liver, everything in the body. And we know so much more about this now. We're going back, 40 years at this point when this was happening. And so that really set the stage for a lot of stuff for me. And then we moved to America and we ate very clean and very healthy there because everything was homegrown and it was seasonal and it's just how it was. There was no processed food. We moved to America and this was in 1989. And this is like back where like the powdered mashed potatoes were in and, all these things. And I think even though it was so unnatural to us, it was also so cool. Like, oh my gosh, like you can make food in 5 minutes by putting water in the mashed potatoes and like voila, there's a meal. And even though my parents didn't love it, I think we kind of just adapted a little bit of that because we wanted to fit into the American culture. And, at that point, I started getting really bad acne. I also had a lot of cavities because the dental care wasn't really good there. And my parents didn't know better. They took me to the first dentist that was down the street where we lived in New York. And it was a very drill happy dentist. And everything that I got was amalgam fillings, right? They didn't really do white fillings back then. And so, the antibiotics, the amalgam fillings. I also had to get revaccinated because the records didn't transfer. So I got all of the vaccines again when I was 10, when I moved here. And then, as I went through middle school and high school, I had a lot of acne, which that bothered me more than anything else. I had a lot of different things, but that bothered me so much. And of course, I told my parents, please take me to the doctor. We need to do something about it. So what did the doctors do? They put me on more antibiotics and then eventually Accutane. And it didn't really help because obviously there were so many things happening internally. And then by the time I graduated college, I actually went to school for finance originally before I became a nutritionist. And I worked on Wall Street and I was so tired. And I had brain fog. I had terrible menstrual cycles and PMS. I literally couldn't predict what my day is going to look like. So it was hard for me to make plans. My friends were all going out and doing things. I'm like, I don't know how I'm going to feel. I can't. I had digestive issues. I had headaches. I had all of these things. And I went to all the doctors, right? I went to my primary. I went to a gastroenterologist. I went to an endocrinologist. I've been seeing the dermatologist because my skin was still a mess and I was on more antibiotics. Those gave me yeast infections. I needed to see a gynecologist. It was such a process. Eventually, though, I did see one doctor who said, "Oh, I know what's wrong with you." I'm like, okay, tell me what is wrong with me? You have Hashimoto's. And I'm like, what? Like, what is happening? And my mother also had Hashimoto's and she actually had thyroid cancer. She's okay. She had her thyroid removed, but I didn't really understand the connection. Again, I wasn't in this field back then. But what the endocrinologist told me is like, oh, it's likely genetic, but don't worry. Your thyroid is still fine. So yeah, you have Hashimoto's, but we're just going to wait and see. And eventually, your immune system is going to destroy your thyroid. And when that happens, and only when that happens, then I will give you medicine that you'll have to take forever. But until then, don't worry. I'm like, okay. I'm like, but what about all the symptoms that I feel? And, she said, well, your thyroid is fine. So Hashimoto's isn't really going to give you symptoms. So maybe you're depressed. Like, would you like an antidepressant? And I'm like, I'm not depressed. I'm depressed because I don't feel well, but I promise you, I'm not depressed. And so that's really what started my journey because even though I was not in the medical field at the time, though I also had a lot of interest just because my grandmother was a doctor and we always talked about it. But even in like just my finance background, I knew that did not make sense. Like, how do we do nothing? Like, can't we prevent? And I said, what can we do now? And she said, nothing. And so that's where I really started researching and reading books. And, this was right when the internet was starting, right? So there wasn't all of the things that we have access to now. There definitely wasn't social media. So it was just a lot of books. And like, that's when ebooks first started to come out. And, after kind of going through doctor, I was like, I'm just taking matters into my own hands. And then I found a naturopathic doctor and a clinical nutritionist who actually showed me what everything, where everything was stemming from. We found I had so many imbalances. There was candida, I had mercury because of I had 16 amalgam fillings. I had hormonal imbalance because of some of that. I also had a copper toxicity. I had a very bad zinc deficiency. Um, there were so many different things, like more that I can name like two hands. So we started working with this naturopathic doctor and we changed my diet. We started doing very gentle detox. We did a candida cleanse. We started to balance things and things started to shift. Obviously, it was not overnight because there was so much going on. But what really was neat is that because everything in the body is so connected, when we started to change one, two, three things, other things started to get better, even though they didn't seem like they were related. Like my skin got better as we did a candida cleanse, right? I lost weight, my energy got better, my hormones started to balance. We didn't do anything specifically for hormones, at least that I understood of back then, right? But my menstrual cycle regulated. I was doing like 45 to 50-day cycles, and I went back to a 28-day cycle. So much shifted. And I was just so amazed by this because it was just like, wow, my body's so amazing. And like when you do the right things happen. And so I ended up going back to school, but I didn't go back to school necessarily to do this as work. I went back to school because I was so intrigued. I wanted to learn more so I can help myself more. I mean, the doctor was helping me, but I always want to say, okay, well, what other pathways are there? What else is there? And as I was going through school, friends started asking me, oh, well, can you help me with this? And what about this? And what do you think about this? And should I eat this? And what about this supplement? And so it kind of started out very kind of just helping friends. This was almost 23 years ago now. And then I said, well, wait a minute, I can actually do this. And, I got my master's, I got a ton of other different degrees and lots of continuing education, and then started my practice 20 years ago. And 20 years later, here we are.
We are. Oh my gosh, so relatable. So many red flags too of that I think myself and a lot of the listeners can probably relate to, especially for those of us who are like Gen X or mature millennials, like the processed food, the treating everything with antibiotics. I mean, so many rounds of antibiotics as a kid. It was just like, oh, you're sick, here you go. Like no big deal. And then with the Hashimoto's diagnosis, I'm just like shaking my head, like, why does this happen so much? There's really a massive blind spot with autoimmune care and treatment and counseling in conventional medicine. I wonder too, how long did I have Hashimoto's before my thyroid lab showed anything? Because when we say, I'm curious about my thyroid, what do they test? They test TSH.
Yeah.
They don't typically look at our antibodies. So, and you can have Hashimoto's long before your thyroid levels go wonky, right? So, and then just that I'm so happy that you eventually found more holistic care and someone who could show you there are root cause factors here that we can address, especially with when something like autoimmunity is at play, and that you were able to turn things around there. But yeah, I mean everything, the processed food, all of it, the amalgam fillings, like so many kind of things pop up there that it's like no wonder you went through all that. No wonder your body was struggling and suffering and out of balance. But yeah, wow, what a powerful story. Thank you for sharing that. Let's go ahead and get into thyroid types because, I know we're already kind of like segueing into that with thinking about our thyroid levels, our like how those different pieces of the puzzle come together. And I'm excited to learn about this and share this with the listeners. What are thyroid types? Um, what's that concept? Why do they matter to us when it comes to our symptoms and healing and treatment?
Yes. So, first of all, everyone has a thyroid type. And what's interesting is even if people have a thyroidectomy due to thyroid cancer or nodules, they still have a thyroid type based on the medication that they take. So that's really, really important. The other piece of that is that with Hashimoto's, and like you said so eloquently, there's so many people who don't even know they have Hashimoto's because a lot of times, unless you test antibodies, right, your thyroid levels don't show that. And what's interesting too is that if you have hypothyroidism or slow thyroid, 85 to 90% of cases of hypothyroidism are due to Hashimoto's. That's the reason. And I think a lot of people don't realize that. And so they think, oh, I just have hypo, not Hashi. But the confusion is that so often when I talk about thyroid types, people will tell me, Ina, I know, I'm the hypothyroid type or I'm the Hashimoto's type. And so not quite. Hashimoto's is your diagnosis, and just as hypothyroid is your diagnosis. It's either both or one or the other, right? But what thyroid types are is basically how the thyroid is functioning and the type of slowdown that you have, right? So two people like you and I, right, can have hypothyroidism, right? We have hypothyroidism, but the reason why our thyroid is slow and how that slowdown shows up is going to very likely be different between me and you and the next person and the next person, right? And that's what thyroid types are. It's essentially the type of slowdown that you have and the underlying reason for that. Now, in order for us to understand thyroid types, it's really helpful to first understand how our thyroid works. And I promise I'm going to make this really simple. This isn't going to be a science lesson, and there's not going to be a quiz after, but just something for people to see how things work. Because I promise you, once you see how it works, it's going to be like, oh my gosh, like there's this light bulb that's going to go on. Because again, in conventional care, all that's tested is TSH. And if it's high, then you have hypothyroidism. If it's normal, it's fine. And if it's low, they'll tell you have hyper, but that's not even always the case. So with thyroid, our thyroid is responsible for producing our hormones, but there's so much more to that. Actually, the hormone production really starts in the brain. So our pituitary gland is what stimulates our thyroid, and it does that via the hormone TSH that we all know. And then that is what stimulates the thyroid to produce T4 and also T3. However, it produces a lot of T4, like 94%, and it produces a very small amount of T3, like 6, maybe 7%. But what's important to know is that T3 is our active hormone. So T3 is what goes to all of our cells and what helps us with metabolism, with energy, with hair, with skin, with nails, with digestion, with cholesterol, with inflammation, with mood, all of the different things that we know thyroid to do. And so people often say, okay, well, hold on a second. I don't understand. If T3 is active and if it's so important, why in the world would our thyroid produce so much T4 and so little T3, right? It's T3 that we need. Good question. The thing is, the body's really smart. So nothing is done just because. There's always a reason. We need thyroid hormone for all of our cells, literally from our head to our toe, everywhere. It's used for everything. And so because we need thyroid hormone for everything, if our thyroid, right, which is here in our throat, produced the T3 right in the thyroid, the cells around it would get the T3 and there wouldn't be as much to go around because all of these cells are going to want it, right? So our body is so smart. And what it does is the thyroid produces the T4. And then the T4 has to travel to different places in the body. And then it converts in other places so that it's not kind of monopolized, if you will, in one area. And so the conversion sites in the body are your liver and the gut, mostly liver, but a little bit in the gut. And hormones, think of hormones like children, right? You wouldn't let your child just roam around on their own, right? Because if they're little, right, like they would need to be with you or chaperoned in some way. So it's the same thing with hormones. Hormones can't just go around wherever they want to go. They need to be chaperoned. So I always tell people, think of it as like they get on a truck or they get on the bus. Essentially, they are transported by proteins, but just for the sake of this example, we think they're going on a bus or a truck or a car. And so T4 then is going to be shuttled via the protein or get on the bus and go to the liver and also go to the gut. And there is where it should, and I say should because there could be problems there for a lot of people, but it should convert from T4 to T3. And then there's some other backwards conversions where it goes to reverse T3. I don't want to get too complicated, but the main thing you really want to know is that the T4 converts to T3. And then from there, the hormones have to get to the cell. But how do we get there? They can't just travel on their own. Again, they have to get back on their bus, right? And then the bus is going to travel to the cells. And then once they get to the cell, the buses have to stop. The doors have to open. The hormones have to hop off. They have to then knock on the door, right, which is the cell receptor, and the cell has to accept them. So, as you can see, there's a lot of things that have to happen, right? The brain has to stimulate the thyroid. The thyroid has to produce T4. The T4 has to travel on the bus to the right sites. It has to then convert. From there, gets back on the bus, has to get to the cell. The cell has, well, it has to first stop to get off the bus to get to the cell. And then the cell has to accept it. So, what happens is if you test TSH, your TSH is there's a feedback loop from your T4 to TSH. So if T4 is okay, it'll tell the body, hey, everything is fine. Don't raise TSH. But that's just that first little part, right? Once the T4 is okay, right? What if someone's not converting well? Well, that's not going to affect TSH usually. And what if the hormones aren't getting on buses? And what if they're not traveling to the cell? Or what if they travel to the cell, but the bus won't stop? So the hormones can't get off. Then you have all these hormones, but they're not usable and the cell can't use them. So essentially, the thyroid types are where in this process is the breakdown. And so, the most common one that most people will know about is when they have high TSH, right? Because when you have high TSH, that's usually a sign of hypothyroidism. However, there's actually subtypes of TSH. So in some situations, TSH can be high and hormones can be low, and that's true hypothyroidism, typically requiring medication. And by the way, also, obviously we always try to do things naturally. However, medication, if it's something that you need, we never want to look down on that or frown upon that because I always think of thyroid medication, not even as a medication, because I think for more like holistic providers, the word medication can sometimes feel too allopathic, right? But I always think of thyroid hormone as that medication as an essential hormone, right? So if you don't have enough hormone, you have to replace it because you're doing yourself more harm than good. And I went through that for a while as I was first going through my training. I was saying, oh, I'm not going to do anything that's unnatural because I've done so many medications in my life and it's caused so many problems for me that I sort of went the other way. I'm like, okay, if it's a medication, I'm not doing it. It's only natural, only food, only supplements. And my thyroid was hypo, but I was not understanding this fact. Again, I was learning on my own. It was a long time ago. And, I think with thyroid, you really need to replace the hormones if you need to, right? So if you have a high TSH and low thyroid hormones, most likely the doctor will prescribe you medicine. But there's other subtypes of high TSH. So in some situations, there's some people who may have a high TSH, but they have completely normal hormones. And the problem there is that if you go to a very conventional doctor, they may not test your hormones. They may just, when I say hormones, meaning your T4 and T3, right? They may just test your TSH and they say, oh, wow, your TSH is at a 10. You are really hypo. Here's, Synthroid or whatever it is, right? But if their actual thyroid hormones are normal, the high TSH can be due to other things like inflammation or autoimmune reactivity. So it's so important to look at that and really see that full panel. There's also another subtype where TSH is borderline high and hormones are borderline low, where some people say wait and see, some people say we'll give you medicine, and there's ways to support that naturally or with a small amount of medicine. So it's so important to know that subtype. And then the other thyroid types, the high TSH is very common, but there's also low T3, which is very common too. So that is where TSH may be completely normal, and T4 might be normal, but T3 is low, meaning the person is not converting. And so what's interesting about the thyroid types is that the underlying reason for each thyroid type is going to be different. So if someone has a high TSH, it's usually either because there is hypothyroidism, right? Or the pituitary is not stimulating the thyroid properly, or, they can't produce the hormones or other inflammatory things, right? Whereas if someone has a conversion issue and they have low T3, it's typically not because of the pituitary gland. And often it's not even because of the thyroid, because the thyroid may be producing plenty of T4. The issue there is that there's something happening with conversion. So whether that's something going on in the liver or in the gut, or there's specific nutrients that you need for that conversion to happen. There's also autoimmune inflammation that happens that can affect the conversion sites. So it's really important when you know your type, because then okay, well, I'm going to look at why it's happening, right? Versus if you don't know your type, then you're just like shooting in the dark. Um, so there's another type called the unavailable thyroid type. And this type is where you have lots of hormones, but this is where the hormones are on the bus and the bus isn't stopping for some reason. So the hormones can't get off. And typically with this type, we see this a lot. With people who have other hormonal imbalances or have PCOS, they may have issues with fertility, they may have other menstrual cycle irregularities. And of course, a lot of the other symptoms, fatigue, brain fog, I feel like those can be across the board. But with this unavailable hormone type, again, it's really important to look at, okay, well, why does it happen? And typically it's because of these other estrogen based hormone imbalances and other enzymes. And so often a provider may say, oh, well, you have low free T3 or low free T4. Well, let me give you some more thyroid hormones so we can raise them. But because they already have hormones that are on the bus, they just can't get off. Doing more medicine in this thyroid type typically is not going to be that helpful because the medicine will just get on the bus with their own hormones. It's a matter of getting those buses to stop and getting the doors to open so that the hormones can get off. And so you could see that they're all very different, which is why it's so important to look at those things. Now, there's another thyroid type, which is the Hashimoto's all normal type. And this one is interesting because this is where someone can have completely normal labs. And when I say normal, by the way, there is regular ranges and there's optimal ranges. And so regular ranges are what we see in the lab. So for TSH, it's usually zero point 0.5 to 4.5, but optimal really is a much more narrow range. So for TSH, that's usually between, 0.5 and 2, depending on if you're on thyroid medicine or not. That may vary a little bit to like 2.5. And the same thing for T4, T3, we have normal and optimal. So with this all normal Hashimoto's type, someone can have completely optimal lab. So their TSH is picture perfect, their T4 is good, T3 is good, they're converting, like everything is happening. However, they have antibodies. And by the way, any thyroid type, of course, with Hashimoto's would have antibodies, but it's specifically interesting with this one because labs are normal, but there's antibodies. And what I was told, and what so many people are told, is like, well, you can't possibly have symptoms because look, your TSH, everything is perfect. But the thing is, and what people don't realize is that the autoimmune attack that happens, right, that creates the antibodies, it's the immune system attacking the thyroid. It actually creates inflammation, not just in the thyroid, but in other areas of the body too, which is why when you have thyroid antibodies, even with normal thyroid labs, you can also have joint pain, right? You can have skin issues, you can have fatigue, you have brain fog because that inflammation is affecting everything. And so for this all normal Hashimoto's type, we may not need to specifically, fix, so to speak, the imbalances in the thyroid because it hasn't happened yet. But what we do need to do is we need to look at what is creating the autoimmunity, right? And we want to do that for all the other thyroid types too, if there's Hashimoto's, but in this one specifically, because this is the type that so often people say, we'll just wait and see, right? But no, we can do something now. And there's a lot of different things that can create autoimmunity. I call them triggers, right? And these are things that can be foods, it could be stressors, it could be toxins, it could be infections. And so the work really is there because it's not a wait and see approach. We want to support that. We don't want to wait.
Hmm. Oh my gosh. I love the clarity that this model brings. It's brilliant and it really underscores why the standard of care for thyroid patients really needs to be improved and fine-tuned and needs to honor these nuances and complexities that go so far beyond just TSH testing and even beyond TSH, T3, and T4, which are like hard enough for people to get from their doctors, right? Or to get explanations on, or to find doctors who even understand like what those numbers mean, how they correlate, what they can tell us about, is the medication we're taking right for us? Is it getting converted? Is it working in our body? Is it getting into the cells? Looking at reverse T3 and things like that. There's a lot of different factors that come into play that really determine how well we do with this. Hey, Thyroid Thrivers, Jenny here. I just want to pop in with a real quick message. If you're listening to today's show and thinking, I want to get started with this. I want to feel better. I need support, and that is my missing piece. I've got good news for you. I have created the group health coaching membership for thyroid thrivers just like you. It's called the Thrivers Club, and you can learn more about it at hypothyroidchef.com/membership. When you become a Thrivers Club member, you get access to me, your personal on-demand health and cooking coach, a full recipe library of thyroid-friendly recipes, including gluten-free, dairy-free, paleo, and AIP recipes. You get access to an amazing, positive, healing-focused community of other thyroid thrivers who get it and who know what it's like to face the unique challenges that we face. You also get access to loads of expert resources created not just by me, but by other thyroid experts, doctors, nutritionists, all kinds of brilliant minds in the thyroid space. And one of the best parts about the Thrivers Club, and really where the results happen for people, is that you get access as a member to our monthly wellness challenges. And those wellness challenges just provide extra inspiration and motivation to make those small but mighty steps that get us where we want to be on our healing journey. Let's find out what happens when you have that support that you need. I'd love to welcome you to the Thrivers Club. If you'd like to learn more, you can go to hypothyroidchef.com/membership. So check out the Thrivers Club today. Okay, back to the show. And it makes me think of so many different people I've worked with over the years, like someone right now who's trying to get off thyroid medication she feels she doesn't need. She's one of, there's that conversation is building steam, isn't it? Of people who are like, I don't need to be on thyroid medication. And then other people where just the autoimmune piece of the puzzle is being completely ignored, overlooked, not tested for. That's the vast majority of patients. And as you mentioned, if you've been diagnosed with hypothyroidism, there's a 9 out of 10 chance you have Hashimoto's. And most conventional doctors are not going to test for it because it doesn't change their treatment protocol. But there's so many underlying factors with autoimmunity, as you brought up, our food, our lifestyle, our stress factors, underlying infections, different root cause things that can come into play that can be so empowering if we understand them so that we're not just throwing spaghetti at a wall. We have the dart and we're aiming for the bullseye with our food, lifestyle, and medical treatment choices. So, oh my gosh, my brain is just like, really lit up with this concept. And thank you for sharing it so clearly. I love the bus analogy. And I'm also really glad that you made a point to mention to everyone that if you need thyroid hormone medication, there is no shame in that. There's so much mistrust of big pharma, and I totally get that and where that comes from. I think we've arrived there for many good reasons. However, it's something I really try to get across in my messaging too, because what I see is sometimes that fear of any pharmaceutical at all. We might skip that at our own peril. And it's something that we need. I remember I was interviewing Dr. Kelly Halderman. She's one of the co-authors of the Thyroid Debacle.
Yes.
And she said, we were having this discussion, and she said, glasses aren't natural, but you need them to see. Some of us need them to see. And when needed, thyroid hormone replacement medication, your levothyroxine or liothyronine or, whatever it is, it's like those glasses. Your body needs that in some cases to function. So, thank you for, clarifying that for the listeners. So, okay, so we've got it established. Not all thyroid patients are the same. There can be multiple kind of different manifestations of thyroid imbalance, maybe involving lack of ability to convert thyroid hormones, maybe involving autoimmunity, it may be involving other things, different indicators that we can look at. how can we kind of start to translate that into our treatment decisions?
So this is where the thyroid type is so important because then you know which way to support it. So, for example, if someone is a low T3 type, then we first want to, and obviously the Hashimoto piece, we want to support no matter what our type is, right? We want to look at our triggers and lifestyle and infections and toxins and stressors to calm the immune system. But then for the thyroid itself, right? If someone's low T3, we want to see, okay, well, because the liver and because the gut plays such a big role, is there something going on there? And so for some people, that may look like cleaning out the liver, whether that's a very gentle liver cleanse. I don't like to do harsh cleanses with Hashimoto's. It's too much for most people, but it's looking at the liver pathways and seeing how we can support that. And the same with the gut. It's looking to see, are there any gut infections? Is there candida or parasites or bacteria? And then supporting that. And there's so many natural ways to do that with herbs and nutrients and doing probiotics after we clean things out and healing the gut. And then it's also really important that then we look at the nutrients that are needed to create that conversion, right? So one of the things that we need for that conversion, one of the nutrients is zinc and another is selenium. And selenium is actually really important for many different things for the thyroid, and it can even help antibodies. And so making sure we have enough of those nutrients. So those we can test through blood. We can also do it through a hair analysis. But I find because so many people are deficient, getting an adequate amount of that is really helpful. So if someone doesn't have the budget to do extra testing, it's very rare that someone has too much zinc in their body or too much, unless they're supplementing, or too much selenium. And, so many people say, oh, I just eat Brazil nuts. Okay, yes, that's helpful, but Brazil nuts are typically not enough for most people to get their levels up. My Thyroid Love supplement actually has a lot of the things that are needed for conversion because one of the things I find with people, I mean, with most people, but especially those with Hashimoto's, is that there's this decision fatigue. Okay, there's this or this. Do I do this or do I take this or this? Do I wear this or this? Do I eat this or this? And so it's amazing how much that weighs on us. And stress is such a big deal when it comes to Hashimoto's, and it affects us so much. So if we can eliminate decision fatigue, oh my, it helps so many things, which was one of the many reasons that I put together Thyroid Love. So everything that you need for Hashimoto's is in one place. And it's also easier to take, and it takes out that decision fatigue. But, those nutrients are really important. And so, knowing the type kind of guides you as to where to look and what to do. And also in terms of medication choices too, obviously, this is for educational purposes only. I'm not saying that you should change your medication by yourself in any way. This is something that I want to make sure you speak with your doctor. But if you're someone who, let's say, is a low T3 type and you're taking, say, Synthroid, which is T4, you can increase your conversion naturally. So I always recommend that people try the natural things, whether that's the trigger support that we talked about, the conversion support. But I also find, and this is just something I've seen in practice for many years, that if T3 is very low, then not to say that the natural support is not going to work, but it may not get it to where it needs to be. And so in those situations, this is a conversation you can have with your doctor about perhaps adding a little bit of T3. What I usually do is, and again, this is something that you want to talk to your doctor about. Don't do this on your own. But if you look at your total T3 and the levels are less than 75, and again, obviously all the natural stuff is still going to help, but typically T3 support through a medication can be extremely helpful. And that's also may not be necessary forever. That's something that you do to feel better. And then as you wait for the natural support to kick in, because sometimes too, the natural support can include, like we said, doing some cleansing, doing some supplementation, doing some other shifts. But if you are so exhausted that you can't even handle a cleanse, even a gentle one, or you're so exhausted that you can't even make the right foods for yourself, well, that's not going to help, right? So sometimes we need that extra support. And then you can do all of the natural things. But of course, it depends on the person, and you always want to speak with your provider on that. And same for, say, the high TSH type, right? If you know, once you know your subtype, then you would know how your medication is working. Or maybe if you have high TSH and normal hormones, you know that there's an inflammatory component that you want to start to look at. So that's how it informs the care, because then it puts you, of course, working with your doctor. But if your doctor is not um, maybe able to do this, obviously then finding a new provider or someone that can help, or working with your doctor and really being your own advocate, because I think the more you can understand, the more you can help to um, just empower the conversation between you and your provider.
Mm. Yeah, and I think of the treatment, I call it the treatment trifecta, or the thyroid trifecta. It's like food, lifestyle, and treatment. And that treatment, targeted supplementation, can be huge in that. I know I take a lot of supplements right now, and I've been trying to like kind of winnow that down to just like less bottles, but I'm also very particular about like what brands, what types, what formulations, what dosages, so I'm really like fine-tuned there. But I was looking at ThyroLove, your supplement, and it's so thorough in the nutrients that it provides. I was like, oh my gosh, this is like everything I'm taking all in one. So that's a wonderful option for people to explore, if because those supplements can get so expensive too when you're buying like 20 different things, and to have them all in one capsule or one, dosage of caps or whatever, it's can be really helpful for people who want that support, but maybe who aren't like up for or able to, buy like 25 different supplements. It's all in there. So that's definitely worth checking out. As a clinical nutritionist, you've got a really unique and valuable perspective on this. And I'd love it if we could talk a little bit more about like food and nutrients and, how do you help people find what works for their body in that aspect of the thyroid trifecta?
Yeah. So, I think with nutrients, and of course, there are nutrients that everyone with thyroid issues needs, but then also depending on the thyroid type, right? Like if someone, for example, has high TSH, but their hormones are okay and not super low, something like inositol is really helpful. And inositol, there's so much research on inositol. Inositol can also help lower antibodies, which is amazing. And inositol and selenium together, there's research on lowering antibodies. I think B vitamins are really, really important. And, not all B vitamins are created equal. So it's important that the B vitamins are not synthetic and natural. But I also find that with people with Hashimoto's, we have different methylation types. So methylation is how essentially we process our B vitamins, and it's a very complex thing. But just to kind of simplifying it down, there's certain genetic mutations that can make us not methylate as well. And there's so much talk about not having enough methylation or enough methyl donors, and I think there's not enough talk about the other side of that. So the people who are over methylating. And again, not to get too complex, but essentially, when you have B vitamins, you want to stay away from things like cyanocobalamin, which is the synthetic B12, or folic acid, which is the synthetic folic acid, because your body has to take like 5 extra steps to convert it to the natural forms. And so everyone talks about, oh, you need methylated Bs. And yes, you do, but there's also B vitamins that are unmethylated but natural. So for example, for B12, there is adenosylcobalamin and hydroxycobalamin. These are natural B12s that are unmethylated. And I have those in there because a lot of people with Hashimoto's may not be completely under methylated. They may be in the middle. They may be even slightly over. So it's about that balance that's really important as well. But B vitamins are important. You just have to make sure that you get them in these natural forms that are not too over and too under methylated. Calcium is important. Magnesium is really important. Um, And vitamin A is another big one for thyroid health. Vitamin E is also really important. Vitamin E is actually interesting because it's an antioxidant, but there's different types of E. There's alpha, gamma, tocopherols, there's mixed tocopherols, and alpha is what's typically used. But, again, in nature, like if you eat a carrot, right, or you eat a pepper, you have all the different tocopherols in it. So, and again, you can't completely mimic nature, right? That's where whole foods really are like the number one thing. But again, because our soil is depleted, right? The foods, even in organic foods, they travel so long from the farm to the market, right? The nutrients aren't the same, which is why we want to supplement and we want to try to mimic nature as much as possible to use the most natural vitamins in the forms that they would appear in nature, and so like with the mixed coffers with vitamin E, that's really important. But food really, like you have to start there. I always tell people, I love vitamins. I'm a nutritionist, right? I talk about vitamins all the time, but you cannot supplement your way out of a bad processed food diet. So the diet piece is really huge. And I mean, this is so your world, and you're just so amazing at this, and really helping people to make the best choices and eat whole foods. The one thing that I do want to say about that, with, again, autoimmunity, right? The more natural, the better. But I do, not but I should say, and macros do matter. And I think depending on the thyroid type, and especially depending on what the goal is, sometimes, people could be eating really clean, but let's say their goal is to lose weight. They may be feeling good, but they may not be losing weight. And typically, if that's the case, that's where you want to kind of dig a little bit more into the macros to see how you can shift things more for your thyroid type. And then, of course, at the same time, also making sure you're optimizing your thyroid, because you could be eating super clean, but if your total T3 is at a 60, which is very, very low, you kind of need that combination. You need to get that up so that you can actually absorb and utilize all of the nutrients from the natural food that you eat.
Yes, well put. And so important to eat those, colorful whole foods. And I'm glad that you mentioned the macros too as something we can tweak. I think sometimes we can get hyper focused on the macros, and like protein is so
Yes,
dominant in the conversation right now. I'm hearing more about fiber, which I'm happy about, but also like so many of those micronutrients you talked about, the vitamins and minerals too. All of that comes into play, and I love how you sort of can, you've got your arms wrapped around all of that, which is very cool about what you do. And thank you for bringing up, the weight loss piece too, because that's such a common struggle that we face of like I'm doing all the things. I'm eating the whole foods diet. I'm moving my body. I'm managing my stress. Why can't I shed even 1 pound? That's very, very common for a lot of us as thyroid thrivers. So lots of, interesting things that you touched on there. And, even the methylation piece, I'm just like sitting here like nodding along because I'm someone who doesn't methylate super well. And fine tuning that with the help of my naturopath has been a huge game changer. So I just want to like give that, personal testimonial to that does matter. The type of B vitamins I was taking at the time I thought were right for me, but were not quite right for me. And we figured that out with the help of some more functional testing, looking like,
that's amazing.
yeah,
What were you, if you wouldn't mind sharing, what were you taking and what are the ones that were better for you?
it was here's what's coming to mind because the names are long. It's like hydroxycobalamin versus
Uh-huh.
methylcobalamin.
Yep.
Also adding P5P
Yeah.
was helpful for me. We're getting technical here,
Yeah, yeah, yeah.
and it's honestly a lot of that is like beyond my expertise as
Yeah.
well. So it really was important to have the help of, my doctor to look
That's
at that. And
amazing.
yeah,
Yeah,
she's
that's
really great
so.
with supplements. And
Mhm.
also I needed molybdenum because
Mhm.
I was reacting to sulfur. My sulfur bucket was getting full. And so just giving those personal examples, not, to say that's what everyone should do, but just to paint a picture for people
Yeah.
that these were game-changing moves on my thyroid healing journey, dialing in the proper supplements for me and my unique body, and we're all different. So if you're feeling like I'm eating all the right things. Why am I not getting results or sometimes feeling worse? Like that's what happened with the sulfur overload for me. Suddenly I'm like not able to eat garlic and onions and kale and all these sulfur rich foods that are so good for us, so detoxifying. Some of us have that where we're just not processing it as well. So some supplemental support gave me back my ability to enjoy those foods. It's that I don't even think about them anymore. I just,
Right. Right.
I have that support, that targeted supplemental support for my unique body that came from testing and holistic slash functional, healthcare. So it really can make a huge difference finding the right practitioner to work with and getting those tests. It's hard because it's out of pocket so often, right? But
Yeah.
so worth it. So worth it. Yeah. Yeah. And you're touching on so many aspects of that really do make a huge difference for people and helping overcome those hurdles and those roadblocks where it's just like I've hit this kind of wall and I'm
Yeah.
or like the sulfur thing, it kind of came out of left field. It was like, why is this happening now? I had never dealt with it. And then I was like, I've got this weird brain fog and fatigue
Yes.
from
Yeah.
this. And it took a couple years to actually sort that out. But when I did, it
Mhm.
was like, I knew I hit the nail on the head because it's like, well, solved it.
Yeah, yeah, and that stems from methylation and taking those wrong B vitamins, right? And also has a lot to do with cortisol too, and how the body perceives that. It's such an interesting pathway. I love that you figured that out. And there's genetic components too, but there's ways to kind of biohack our way out of that.
Yeah.
So yeah, that's really great to hear.
Yeah, yes. Yeah, biohacking our way out of it. I mean, that's what we're all doing here, isn't it?
Yeah.
Okay, I did want to ask you about one nutrient you mentioned. And for the listeners, I've got a show coming up and an expert coming up on this because I know people have reached out and asked me about this. This has been on my mind. Calcium, because so many of us find that we feel better without some of those very common dietary triggers. Gluten and dairy top the list, right? And being dairy free for some of us is like how we can lower inflammation and heal our guts and prevent leaky gut. I mean, if that's a trigger for some people, we really do feel a lot better and thrive more without those foods. Because dairy is not unhealthy, but I always say if a healthy food is not right for your body and it's
Mhm.
causing leaky gut and triggering this cycle of inflammation, that's a cycle of disease, and that healthy food may not be healthy for you. And a lot of people in this community do find they feel better dairy free. And so calcium for people who find not maybe I'm dairy free long term, or maybe I'm dairy free and I have been able to reintroduce just a little bit of dairy. Like the great thing about dairy is it provides so much calcium. When you look at other plant foods, there's calcium in lots of other foods, right? And we can get into that, but it can be difficult to get adequate calcium, I find, and I've tracked this, for me personally, without dairy. And I'm one of those people, I do better with very little dairy. There's certain types I can have as like a treat in small amounts. But eating dairy as a staple in my diet does not work for me. I know it's one of my dietary triggers. And, so many people in this community are in that same boat and thinking, okay, I've been dairy free or even minimal dairy for years. What does that mean for my calcium and my bone health? And I thought, I've got to ask Ina about this because I know you've got that really, fine tuned lens that you can see all these pieces and how they fit together, including as with the thyroid piece, which can affect our bones too. So, can we maybe touch on that in our conversation?
Definitely. So I'm like you. I cannot do dairy. I rebelled against it for a long time and I kept trying, thinking, no, 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 I could do it. I could do it. But dairy gives me acne still. Even at 46 years old, I have dairy and I have pimples. So I'm sure there's obviously other inflammation happening. The pimples is just what, you see on the outside. But there's tons of inflammation on the inside. So I also don't do that. But here's the thing with dairy. Yes, if you look on paper or if you look in the nutrition label on milk or cheese, it's going to have a certain amount of calcium. But it's not about what something has, it's what your body does with it and how well it absorbs. Because dairy is acidic, the amount of calcium that's in it is not the amount of calcium that you're actually going to get. So I think it could be really deceiving that people think, oh, I'm not eating this, so I'm missing out on 1,000 milligrams of calcium. But I don't necessarily agree that you're missing out on all that much because when dairy is acidic, because it's acidic, and especially when it causes inflammation in your body is actually going to pull calcium out of your bones to neutralize the acid of the dairy. So you're not really getting that much. I mean, you may be getting it, but then you're pulling other calcium out. So in terms of that dairy really helping your bones, I don't know. And I mean, if you think about it, with osteoporosis, right? We have the highest rate of osteoporosis, yet we consume the most amount of dairy in this country. And also most likely take the most amount of calcium supplements as well. But if you look at areas like Asia, their osteoporosis rate is really low. They don't consume a lot of dairy and they certainly don't take a ton of calcium supplements.
Mhm.
So calcium is definitely important, but it's one out of the main things in like the puzzle of bones because we need that calcium to absorb. We need magnesium for the proper balance. We need the vitamin D to absorb it, but you also need vitamin K because vitamin K is kind of like the police officer. It tells calcium where to go because if you get calcium and it doesn't go in the right place, then you're going to get calcifications in your arteries, right? And we definitely don't want that. And in other areas, you can get in the joints and cause stiffness and almost like arthritis type symptoms. So, you can absolutely get calcium from non-dairy sources, right? Our leafy greens, our broccoli, our nuts. I do like to supplement with a little bit of calcium for some people, but again, it's important to test. I like to look at calcium in hair because you could see what the tissue levels of calcium are and then if needed to support. But again, if I personally don't like to do a lot of calcium without a combination of magnesium, vitamin D, and vitamin K because they all work together. But then the other thing when it comes to bone health is because our thyroid supports and controls everything in the body, literally we need it for every cell in the body, right? Like we talked about, optimizing your thyroid also has a huge effect on your bones. So when your thyroid levels are optimal, right, to 4, T3, everything, it helps your bones. And I have so many different stories about that and how people's bones and bone density got better without doing calcium, right? Without doing these other things, but just by really supporting their type. The other thing is that as we go through perimenopause, and perimenopause really starts at 35. I know that's a shock to a lot of people, but it really starts around 35. And perimenopause is anywhere between 10 and 15 years, and then menopause, the average age is, I think, 49 or 50 in the United States. But as our estrogen starts to decline, that has a really, really big effect on our bones. And so, really looking at that and seeing, if and how to support hormones. And there's many different ways of doing that, whether that's through hormone supplementation or there's some more natural support, depending on, what someone may want. So that's another avenue that's really important. I think that, people think, oh, I just take a lot of calcium and then my bones are going to be good. But this happens all the time. And yet people have fractures and they have, we just have such higher rates of osteopenia and osteoporosis. So, there's more to it than that. But again, like some calcium is important and you can get it through other sources for sure.
Mm-hmm. Thank you so much for that. Yeah, there's so much to it, isn't there? Concerns about supplementation, as you mentioned, with calcification. And then, yeah, one of my doctors said, we'll go just do the calcium calculator. There's like I can't remember, it's through like the Osteoporosis Foundation or something like that. But you can do this calcium calculator where you track how much you're getting. And, it is hard to get the recommended amount. Is it 1,000 milligrams a day or 1,200 a day or something like that?
100 sometimes. Yeah.
Yeah.
Um,
Through plant, like I mostly get mine through greens and
mhm.
broccoli and almonds
Yeah.
and things like that. But yeah, really interesting about the absorbability of that calcium versus like the calcium in dairy, and then all those other nutrients that come into play with our bone health picture. So yeah, thank you for giving us some clarity there. And yes, again, for the listeners, there is episode coming up. Dr. Susan Brown's coming on the show. She's a bone health expert. So we'll dig deeper
Excited to
into
hear
calcium,
that.
but yeah, I appreciate you weighing in on that. One more question for you. You know, you've talked about thyroid types from a lab and physiological perspective. And one thing I've noticed as a thyroid health coach for the past 10 years is personality types, certain personality patterns that show up a lot in thyroid patients.
Mm.
And I wondered if you had seen similar trends in your practice.
Yeah, for sure. I find thyroid, but also just Hashimoto's and autoimmune. And there's so many different traits, but they're similar. So I often see, and I think it's, thyroid and autoimmunity together, is the perfectionism and the people pleasing and, saying yes when you really mean no and doing things to not rock the boat and doing things for everyone else but putting yourself last. A lot of that also has to do with our thyroid is in our throat chakra, our fifth chakra, and this is really all about the freedom of expression and saying what you really feel and think and kind of saying your truth. And that's scary because if we're afraid of what other people are going to think, rejection, hurting someone, and a lot of that really comes from like back in the day, right? Because if you think about it, in Paleolithic times, if you were in a tribe and you were rejected and you're kicked out of the tribe, you are dead, right? You're going to be eaten by bears because you are not in the tribe and not protected. So like fear of rejection goes back to like our ancestor as like if you get rejected you're going to die, which is and like it's generational and we still have that. And so I think there's just in general that like wanting to be like the fear of rejection. And, that's where I think the perfectionism, the people pleasing, like not being able to really say what you want comes from. And, it's not easy to shift because we don't want to hurt people's feelings, right? And we want to be liked, but that's something that we can practice slowly by, even just journaling it even before you say that. And really, I think a lot of people with autoimmunity and thyroid issues are, they don't give themselves permission to really feel what I would say even before that, really think about what they want and then really feel into what they want. Because I think, well, I'm not important, right? There's that like minimizer, like I gotta take care of my family and the kids or this or that. Like I'm not so important. Like I'll be fine, or everything's okay. It's not so bad, you know? And I think like the first thing is like actually start thinking about what do you want and what do you like? And when I ask people that, they're like, oh, I don't know. I'm like, that's okay, that let's work on that. Let's write a list, like next time I see you, come back with a list of 10 things that you like and give yourself permission to go there. And then the other thing is asking for help because again, so often if you ask for help, you are weak, you are incapable, right? There's so many different like underlying limiting beliefs of this. And it's that understanding that you can't do it all by yourself. And that's not a bad thing, right? Like it's actually like, no, like if you could do it all by yourself, then like it just wouldn't work, right? Like you would be so exhausted. So it's like you're not weak and there's nothing wrong with you. Like it's impossible, like humanly impossible to do it all. And if you try, you're just going to set yourself up for failure. So it's being okay with asking for help.
Hmm. It speaks so much too to maybe the reasons behind why so many more women have thyroid issues than men.
Mhm.
Women are 5 to 8 times more likely to develop a thyroid issue than men are, and I think that speaks to so many very common sort of hardwired
Sure.
tendencies in us. And yes, I echo so
Mhm.
much of what you've observed in your experience with lots of high achieving women, lots of kind of perfectionist, type A. Also, I see a lot of highly sensitive people. Um, just the sensitivity even to uh, not just like being empathic, but also that sensitivity to what we put in our bodies, to our environments, to smells.
Yep.
Yeah, lots of interesting things there to note and be able to work with people on. The healing goes so far beyond just the food, the nutrients, the treatment. It's also really a spiritual and personal growth journey. So it's all those pieces of the puzzle, isn't it?
It is. It's such a whole body approach. It's important to look at all those pieces for sure. And, I think the important thing also to know is that they all fit together because I think so often people may say, oh my gosh, you want me to do this and this, like, what? Like, how am I going to do that? Right. But it's not about thinking about, okay, you have to do these 20 things, but it's like you work a little bit on this, a little bit on this. And then as you do that, this will open up for you. And then this will be easier. And then this over here is going to come together. So it's not about adding more things. I mean, I think it's also about simplifying and then, as you start to do work more on the spiritual end of things and the emotional end of things, it then simplifies some of the other stuff too. So it all fits together. It's very interrelated.
Yes, well put. Amen to that.
Mhm.
Ina, thank you so much for helping us cut through the confusion here and for sharing your insights with us today and your wisdom and expertise. It's been great chatting with you.
Thank you so much for having me. I loved our conversation and
Me
I'm excited
too.
to stay connected.
Me too. You've got so many amazing resources for thyroid patients from your Thyro Love supplement that we talked about to your weight loss and Hashimoto's energy programs. Where can listeners find more about your work?
Thank you. So they could find everything at innatopiler.com. Thyrolove is on there too, but Thyrolove also has its own website, which is just thyrolove.com.
Awesome. I'll be sure and put all those links in the show notes for you. And if this episode resonated with you, be sure to check out Ina's Thyroid Mystery Solved podcast, along with her programs and her supplement line at thyrolove.com. And until next time, take care, everybody, and keep on thriving. See you next time. Thanks so much for spending this time with me and tuning into today's episode of the Thyroid-Healthy Bites podcast. If you've enjoyed today's show, please don't forget to like, subscribe, or leave a review on your podcast platform of choice. Your support makes this show possible. For more thyroid healthy food and lifestyle inspiration, check out my free library of thyroid-friendly recipes and lifestyle content at hypothyroidchef.com and the Hypothyroid Chef YouTube channel. As we wrap it up, head to the show notes for information and links to everything we talked about today, along with the link to my free thyroid-friendly grocery guide download. I'm Ginny Mahar, your thyroid health and cooking coach, wishing you happy cooking, happy thriving, and the best of health. See you next time.